Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Urbana Public Health District, Julie Pryde. Julie, we have had the most eventful week that I can remember in news since the pandemic began. Would you agree?
I would agree.
Let's talk about the president in a second, but before we do, let's talk a little more locally. How's Champaign-Urbana doing?
Well, as of today, we have a total cumulative 5,003 cases, 375 active cases right now, meaning that they are all in isolation, and everyone that was a close contact to them, which is anywhere between 2 to 5 people usually, are in quarantine. We currently have 6 individuals who are hospitalized, and unfortunately, we've had 24 deaths. We've done a total of, in our county, 567,000 plus tests, which is unheard of.
The President of the United States, since we talked last week, has been diagnosed with COVID. The timeline is still a little bit unclear, but he started feeling fatigued, and then it's reported he had a fever as high as 103, and then it was reported he had a cough. Now, have you heard anything about his prognosis at this point?
No, I mean, it's just the same stuff that everybody else is hearing on the news, which unfortunately is all over the place. I can tell you that the drugs he's on, I can tell you when those are usually used. He seems to be on everything that's out there pretty much. But they don't usually do the steroids until they're having problems. So I don't know. We're just not getting the information that you'd normally get. But what I can tell you is if you ever wanted to see an example of what happens when zero public health measures are followed during an infectious pandemic such as this one, this would be the case study for it. We have seen people who, they were relying on these rapid antigen testing, which is that's not good. They're just not that great, and they're just sort of a little point in time test, but they also, the problem with them is they have a lot of false negatives and a lot of false positives. So in order to be a case, you actually have to have it confirmed by a PCR test. So that's what we are seeing now, is that we're seeing exactly what we knew we would see. I knew Thursday night when I heard that Hope Hicks had been diagnosed, that every single person that was in the helicopter, every single person that was on the plane, and likely lots and lots of other people are going to be positive from that. You look at all these scenarios, they're not wearing masks, they're not social distancing, they are not doing isolation and quarantine, which I don't understand how that works. I guess I only know how it works with a local health department. I don't know how it works. Apparently it doesn't when you're dealing with the current administration. But this outbreak is in no way over. It is just starting. Everybody who was at the fundraisers and things afterwards, after the initial illness, they're all at risk. So it's just going to keep going and keep going and keep going. Then they go back into their homes, they go back into their other, jobs or wherever they're going, and it just keeps spreading. If one of them worked at Champaign-Urbana Public Health District, for example, they would come in here positive, but they would not spread it all over the entire agency, because we do the prevention, we do the masks, we do the social distancing. But this is what happens when you don't do it. You're going from location to location to location where no one is following the basic public health guidance. And if we don't see deaths out of this, I will be very surprised.
Let's talk about the fact if Julie Pryde and Champaign-Urbana Public Health was in charge of this. Let's say the timeline, the president gets the diagnosis, finds out Thursday night that he is positive. He's been to a rally in Minnesota. He's been to New Jersey to a fundraiser, a buffet of all things. Mm-hmm. If you were in charge of this outbreak, how would you handle it with contact tracing all the way to quarantining? What would you do?
Well, just to be clear, any public health professional in the entire country, and obviously the CDC, anyone would be doing it the same way we're doing it. This administration just somehow doesn't play by the same rules. But what would happen is as soon as someone had a positive test, they would be immediately isolated. They would have no more contact with anyone else. So they would be, we would contact trace everyone who was around them 2 days prior to. They would be put into quarantine. So that is absolutely everyone. But then we see what happened. They went on to go spread it. And then if they were in other locations, well, first of all, they wouldn't have gone to the other locations because they would have already been in quarantine. And then, but if they did, what the local health departments do, or whoever's doing the contact tracing, collects that information, reaches out to the other local health department and the other jurisdictions, and they work on it together, or then pass it off. So you need to make sure that everyone understands that they have been exposed, and then they, for 14 days, whether they have symptoms or not, whether they test or not, they need to be in quarantine. That is the only way to shut these outbreaks down. And thus far, this one is not being mitigated in any way that, as far as I can tell from, what I read and see on the news.
Okay, I have one more question in regards to this, and it is about the accountability. Hope Hicks, her diagnosis was discovered through good journalism.
Mm-hmm.
Is it our responsibility if we are testing positive, especially somebody in that public of a role, especially somebody who's that close to the President of the United States? Isn't it our job to disclose to people that we've been in close contact to that we have tested positively?
Well, that would be ideal, yes, but it's really whatever the local jurisdiction's health department's responsibility to do that. Clearly, in this case, there is zero communication or cooperation, because at the very first sign of the positive test, you would go back 2 days prior to that and then find out everyone who had contact with her, and everyone would be in quarantine for 14 days. It doesn't matter if you have an important meeting or a fundraiser or your child's wedding or a funeral or whatever. You have to stay in quarantine. Otherwise, you start, and what we're now seeing, you spin off multiple outbreaks.
Let's go back to the medication that you mentioned, because Donald Trump is on a cocktail. We've talked about the steroid, and he and both Chris Christie got admitted, and it's unclear how severe, if they have viral pneumonia. We're not really getting a clear story. If the average person gets a COVID diagnosis, do we have access to these 3 medicines that are supposedly a great cocktail for treatment?
That depends on, that depends on where you live and what the situation is. But in general, I can tell you that if you have a COVID diagnosis, you're not going to be hospitalized like what Chris Christie did, just in case. I mean, that just doesn't happen anymore. That this is part of the problem. And again, this is a good glaring example of some of the problems that we have in this country with the healthcare system. It is grossly unequal and unfair. And rather than putting all the money and the emphasis on the front end on prevention, we worry about the back end and, doing these heroic measures at the back end of it, instead of really focusing on the much cheaper, much better preventative measures.
Do you feel now that we are at a crucial moment that Donald Trump could finally become the poster child for why wearing a mask is important?
Well, if reading comments on, in media posts is any indication, no. I don't understand it. I don't understand why this is happening, but it is happening. And leave our county and see what it looks like in other counties around here. Leave Champaign-Urbana. People, for whatever reason, are not taking this seriously. There are certain people apparently who cannot understand or grasp or care about this unless it affects them or their family personally. I find that frustrating and sad, honestly. It is sad because every one of us, if we were to be infectious, we could infect somebody and essentially kill them. I don't know about you, but I would not want that on my conscience, ever. So we need to really take these matters seriously. They're simple things to do. I have colleagues around here who tell me that, from health departments, who tell me that they have people calling them and saying because their county won't pay attention to masking that they're coming to Champaign to shop and to do errands because they can't even do things in their own county. And if you're a person at risk, it could literally, kill you. And plus, we don't know what it's doing to everyone else. I keep reminding people of this. This is not a virus to mess with. We're like now 10 months in from ever hearing about it. We see what's happening. We're over 210,000 dead by the end of the day. And by this winter, we're not even in the scariest part of it yet. The scariest part of it's coming up. And if we can't get people to take it seriously, we're going to see maybe 3 times the number of deaths a day in this country. And that it's preventable and it's unacceptable.
What makes this virus so unique and so different from the flu is its ability to spread, how contagious it is. Is it guaranteed, when I look out at the audience of maskless people last week at a Supreme Court justice event, is it guaranteed that if you were in contact with somebody with COVID, that you will get it? Or is there are there a percentage of people whose bodies just say, nope, I'm not taking in this virus?
That I don't believe is going to be the case. There are going to be varying levels of problems from that. Some people will be asymptomatic and get over it fine. Some people who are normally healthy will still have very serious problems with it. Some will die. So, no, that's not the issue. The issue is that it's very transmissible, and every single time you risk exposure, you're rolling the dice. And that's exactly what you're doing. And if you are someone who is older, has underlying health conditions, are obese, any number of things, you are at even higher risk. So, but it can affect and can kill anyone. And it's proven that already. Younger, healthier people are dying from this as well. And certainly not in the numbers of older and sicker people, but they are. And why would you risk that? Plus, like I keep saying, we don't know if this is going to cause some type of long-term disability in people. We just don't know that yet.
One thing we do know about is influenza, and we are coming up on the season if we're not already starting it. I got my flu shot, you got yours. My parents got some kind of special double shot. What exactly is that this year?
Yeah, well, that's been around for a while. It hasn't been advertised, I don't think, as much, but there is, for seniors 65 and older, there is a vaccination that is specifically for seniors. So it has an adjuvant that will cause a more robust immune response, or, they call it the double shot. It's not really exactly a double shot, but it is a different shot than what other people get. So, if you're over 65, they're going to probably recommend it to you wherever you go. So get that one if it's available. Everyone else, please take it. I am so proud of our community, as usual, because the flu clinic lines are going wild. Places have had to order more vaccine in. So it's wonderful to see people taking it seriously, because that's how we're going to protect our healthcare system.
Last question before I let you go. We've all found ways to see loved ones. I haven't hugged my parents in 7 months, but we've met at a park, 6 feet apart with masks. Now we're coming up on cold weather. I'm not going to stand in a park and talk to friends when it's 20 degrees outside. How can we safely take our interactions inside with other people?
Well, it's going to be, bigger spaces, airflow. So, you may have to have a window open, or you may have to have a much larger space. You're going to have masks on inside when you're around people that aren't your family, and a lot of distancing. That's going to continue. So that's what we're moving into, and it's been nice to be able to do so much stuff outside. But we're in the Midwest. It's going to get cold. It was actually got really cold last night, but it's going to get a lot colder, and we're just going to have to, unfortunately, we're going to have to come up with ways to protect each other, because this is going to be a long winter. It's going to be a lot of things that we're not used to. We're going to have to figure out ways to reach out to people, provide support. if, people need help with something, we're gonna have to figure out ways to do it in safe ways. And it's really, really tough. It is tough, and we understand that, but we don't want to see a lot of, we don't want to see a lot of fatalities. We don't want to see a lot of disability from this. So we just have to keep doing what we're doing and be creative and share those creative ideas with others.
Thank you for that advice. Thank you to our producer, Jason Liggett. You always make it easy. You make us look good. I also want to thank Urbana Mayor Diane Marlin. Thank you so much for letting us continue this series. And thank you to the person that everyone in the community has obviously listened to because our numbers are low. Julie Pryde, Administrator of the Champaign-Urbana Public Health District. Thank you so much for your time today.
Thank you.